So I thought I would do a little get ready with me video while I get ready for the day. So for those of you who don't know me, my name is Helene and I'm the host of this podcast. I actually started a previous business though called the Spoonie Society, and so I had that for about 4 years. That's what I think most people would probably know me from or might recognize my face from. So we made a bunch of heat packs, and most notably the wraparound heat pack, which I might just even pop like a little photo here and then you know what I'm talking about. So I myself have 6 chronic illnesses, and the first one I was ever diagnosed with, actually I'm pretty sure it was IBS, but I don't really care about my IBS. I know that sounds dumb, but I don't as much, because it doesn't give me as many issues as say like my endo or my gastroparesis. So I have 6 chronic illnesses that in total. So I have endo, adeno, PCOS, IBS, GERD, and I was recently diagnosed with gastroparesis. And I also suffered actually 2 episodes of intussusception in February of this year, which resulted in me spending 4 days in ICU. I had an emergency bowel resection. I had 15 centimeters of my bowel removed. I had 4 bags of blood transfused, 3-hour Met call, nasal gastric tube. I was vomiting like blood and coffee grounds, or like dry blood that looked like coffee grounds, the day of the surgery. So originally I wasn't even meant to be having surgery, and then it was, oh no, you're having surgery this day. And then as I got worse and worse, then it was like, oh no, now you're having surgery in 15 minutes sort of thing, the worse I was getting. So that wasn't very fun. However, I would say my most challenging illness to manage has definitely been my endometriosis. So I have had 4 laps for endo. I've had both my fallopian tubes removed and my left ovary. I have also frozen my eggs. I did 2 rounds of egg freezing in 2022 and have some little eggies on ice when I'm ready to use them. And I'm trying to think other things. For my endo, yeah, it's been stage 4 every time. I've been told, it's the worst they've seen, blah, 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 all that fun stuff. But what I've actually, done about it is, so I've had my surgeries. The first was ablation and the other 3 have been excision. I have had other laps and other surgeries for other things, but just specifically endo. And so the other things I've tried is, so I have the marina in, and I've had it changed every 2 years or every time I've had a surgery. And so I've had that since 2018. Another thing that I've tried is Zoladex. So Zoladex is medically induced menopause, and it's also actually a prostate cancer treatment, and it essentially tricks your body into menopause, and it's this injection once a month you get in your stomach, and it's like the biggest needle I've seen in my life, and I've had local anesthetic just to even have the needle because it's ginormous. So I've tried that for 9 months. That has risks. I have also tried, I've had I think 2 or 3 ketamine infusions now, and I also did a round of pelvic floor botox in December of last year with a sort of 4-day ketamine infusion to help manage the flare, because my pain specialist and I both thought, it was actually gonna probably send me to ED, so I may as well just, already be at hospital to sort of manage it, I guess. And I've done, so ketamine infusions, I've done nerve blocks, and I've done things called hypogastric plexus and ganglia impars. It's basically sort of like a nerve block. I'm trying to think of other things I've tried, other than all just like the hormonal therapies, contraception, heat packs, like all that sort of crap. I've tried acupuncture, I've tried massages, like you name it, I think I've tried it. So that's definitely something I still struggle with very, very much. And I've also been told that I am not allowed to have any more endo surgeries until after I have children. It would do more damage to go in to help me now than it would in the long term. And then, so gastroparesis is the newest chronic illness I've been diagnosed with. And my previous gastro wasn't very helpful, so I'm seeing a new gastro in I think next week or in 2 weeks actually. And I do have an amazing pain specialist who truly I owe my life to. She is just phenomenal. But yeah, that's just like a little bit more about me and my chronic illnesses. So yeah, if there's anything extra you want to know before I talk about it on the podcast, let me know and I will try to answer all of your questions. All right. Mwah.